If you operate a recovery residence in Arkansas, you've probably wondered whether AARR certification is really worth the time, the paperwork, and the scrutiny. That's a fair question. So let me give you the practical answer, not the feel good one. It comes down to four things: referrals, funding, liability, and where Arkansas is clearly heading. The short version: certification is moving from a nice to have to a prerequisite for running a sustainable recovery residence. Operators who certify early gain a real advantage. Operators who wait end up playing catch up. That's not a sales pitch. It's the pattern that's played out in every state where NARR affiliates have gained traction. First, referrals. The single biggest driver of occupancy is referrals from treatment centers, hospitals, drug courts, probation, parole, and case managers. And those decision makers are narrowing their lists to certified homes. Three reasons. Liability. A discharge planner has professional exposure when they send someone to a home that turns out to be unsafe, and certification gives them a defensible basis. Quality. Referral partners have been burned by homes that looked fine on the surface. And policy. Agencies and funded programs increasingly restrict referrals to certified homes in writing. Put a non-certified home up against a certified one for the same referral, and over time, the certified home wins. Second, funding. Recovery housing money in Arkansas flows through opioid settlement dollars by way of the Arkansas Opioid Recovery Partnership, federal state opioid response grants, the Federal Recovery Housing Program through HUD, and private foundations. And the direction across all of them is the same. Certified homes are prioritized or required. If your model depends on public or philanthropic funding, now or down the road, certification isn't optional. It's the gate. Third, liability. A non-certified home operates with no documented standards, no third-party verification, and no formal incident framework. So when something goes wrong, an overdose, an injury, a lawsuit from a neighbor, the operator has very little to point to. A certified home runs on written policies that have been reviewed against national standards. Staff training, incident reporting, resident rights, grievance processes, all documented. That doesn't eliminate liability, but it substantially reduces it, and insurers are increasingly asking about certification status when they set your rates. Fourth, the policy environment. States move through predictable stages as recovery housing grows. First, unregulated growth. Anyone can open a home. Then, certification emerges. Then, funding tightens around certified homes. And in some states, certification eventually becomes law. Arkansas is in stage 2, moving into stage 3. Operators who certify now are positioned for whatever stage 4 brings. Let me be honest about what certification is and what it isn't. It does require real work: documented policies, a resident's bill of rights, clear financial practices, incident and grievance processes, staff training aligned with the social model of recovery, and a site inspection. But for most operators running a decent home, certification mostly documents what you're already doing and tightens the weak spots. What it does not do is guarantee occupancy, eliminate liability, prevent every relapse, or fix a poorly managed home overnight. What it does is establish a credible baseline. Everything above that baseline is still on you. And there's one more frame worth naming. This field has a history of being exploited by bad actors, people who saw vulnerable residents as a revenue source. Certification is the field's answer to that history. Every operator who certifies helps rebuild trust that was genuinely damaged. And in a state that's made real, measurable progress against overdose deaths, that credibility matters to the whole system of care. So if you're ready, the honest path is simple. Start with our certification pre-screener. It shows you exactly where your home stands against NARR Standard 3.0, flags the easy fixes, and gives you a realistic sense of the work involved. From there, most operators reach full certification in 60 to 120 days. The operators who do this in 2026 are the ones who will define Arkansas recovery housing in 2028. The real question isn't whether to certify. It's whether to be early or late. The pre-screener and the full article are linked below.